Good morning, Lord Chancellor. I just wanted to explore some questions regarding the issue of reoffending.
Yeah.
And that is in particular, what practical things are being done or can be done to actually deal with the issue of reoffending. And the first question I have is, does the Ministry have some mechanism or have put into place a system of knowing which sets of interventions will lead to a reduction in reoffending?
One of the things
you can have so many different providers now.
One of the things we're doing now very early on is starting to do some intense work on the data we have available and to create a bank of information that can be used on an ongoing basis going forward. And we're going to help individual providers get a clearer sense of what they currently do. I mean, some of the voluntary sector organisations have been doing good work for years, but actually haven't got accurate data about the impact of it. So we're going to try and help the whole sector understand more clearly what they have achieved, what can be achieved, what works. I basically want to put all the stuff we've got on the table. I want to try and dice and slice it in a way that is helpful to both the probation trust at the moment, to potential partners for them. I think it's really important to do that. So we will be as open and transparent as we possibly can be.
And continuing on with that, how do you foresee reoffending reduce, which is due to the changing method of delivery of the changes?
Well, I think, first of all, in terms of the changing method, this is an evolution, not a revolution. We can't have one system one day and something totally different the next. That is not the intention. What we will have, the way that I envisage this working, is that we will, over the next course of the next couple of years, we will evolve into a situation where we have a public protection capability, as I described, but also a team of people who are today working in the probation service who have moved into a new world, who may have set up their own social enterprise in partnership with social investors, and may have formed partnership with a charity and a private sector organisation, whatever. But it will be the same team the day before and the same team the day after. They will evolve, the ways of working will evolve, the payment by results mechanisms and the professional freedoms allow them to test new approaches, to bring in, to spend their money in different ways that will reduce reoffending. And my goal is to get an incremental change year by year. This isn't going to suddenly start on day one and by day three, reoffending's down by half. What we want is kind of consistent drop, a few percentage points at a time, to that level of reoffending, particularly for those groups where there is a higher level of reoffending. And I would say that we will still have people who are under supervision who reoffend in the way we do today. There are people today who are currently on probation who will be out this morning committing crimes. That will not change, but I want the number of them to be coming down step by step. So this is about reinvigorating, bringing in new ideas, accelerating change, bringing in the other 12-month group, and beginning to get that graph coming down again, because at the moment reoffending's been going like that.
And in continuing of trying to resolve the reoffending, we all accept that there have been long-standing problems with the availability of social housing, alcohol, drug treatment, and mental health issues, which often lead to a lot of those people reoffending. Will the new providers be expected to finance these very costly interventions, as well as administering the sentences that court have set out, and in particular, of course, to carry out as the MOJ has said, one-third of the sentence should have a punitive element in it?
Well, the punitive element, we pay, in my view, far too much at the moment for community payback. Having spent time in the DWP working out costs for full-time activity. Now, I'm not in any way equating full-time activity in the DWP with what we do with offenders, but I do know roughly how much it costs to create an environment where you supervise full-time activity. And we pay too much, and the evidence in London is that we pay too much. So you're right, there's a lot of requirements, and this cannot and will not be a kind of work programme style payment by results system where we move to 100% payment by results. Can't happen because the providers also have to fulfil orders of the court. And so my expectation is, I don't know where the line will be drawn, but part of this will be paid as a fee, and another part will be outcome based.
These other inputs which are so important.
Sorry, so I'm just coming to that. two parts to that. The first is, of course, there are already services and support there, and in part it's about somebody sitting alongside the offender and organising them and make sure they happen and make sure that they're booked into the rehab a month before they leave prison, so when they come out it can start on the day rather than getting them out and then saying what happens next, which is why I think the through the gate service is so important. So in part it's about simply organising resources that are already there locally from other public bodies. We are also having active discussions with other government departments, say how can we leverage areas like drug treatment, for example, make sure there's a close link between what the Department of Health are doing in drug treatment and what we're trying to do on this. That is very important as well. But also in some cases, I would not be surprised. If I were personally running a provider organisation doing this, you mentioned the very important issue of housing. It is extremely important because having somewhere stable to live is, I think, a factor in determining whether somebody reoffends or not. And indeed, one of the probation trusts I talked to, I was quite alarmed because they were talking about the number of people they're supervising who are just sofa surfing. I would frankly, given the fact these people are on housing benefit when they come out of prison, I would personally be doing deals with landlords or even investing in hostels so that when I was supervising offenders, I actually had somewhere for them to live. So that's one of the things I would be doing if I were running a business to that effect. So of course they have the freedom to do it, and the kind of benefit you create by saying, okay, you do what works, is to enable a provider organisation to say, right, we're going to set up our own little mini housing association. We're going to make sure we've got properties available so people coming out of prison have got somewhere to live. And we'll do it on the basis of there's housing benefit coming in, and then we'll try and get them to employment. Now that's the kind of thinking I would be going through, and one of the kinds of freedoms that I would hope that creating independent organisations to deliver this would be able to use effectively.
Yeah, but I think the question was really in relation to things like alcohol treatments and mental health issues, the payment for those things, for example, living, putting somebody in a rehabilitation centre costs a lot of money.
Yep.
That money, is that going to be by the new providers going to have to do it, or is it going to be a separate pot from which that money will come for those specific treatments that need to be carried out?
Well, one of the discussions we're having with other government departments are precisely around exactly how we do that. The fact is we spend hundreds of millions of pounds a year on drug treatment. We want to make sure that there's a joined up system when somebody comes out of prison after a short sentence needing further drug rehab. There's a simple mechanism to get them to drug rehab. Now, whether we do that by creating separate pots of money, or whether we do that by creating separate contracting structures, or we simply actually have wise management of the offender's life that says, right, the rehab centre's here, the PCT or its successor body has the budget to do this, and have the systems in place so that somebody comes through and goes straight into rehab. What we also need is some conditionality to make sure they do. When I went to Holloway, one of the frustrations I had from the staff there was that they have somebody in for a short sentence who's got a drug problem. They might start doing work with them on their drug problem, but when they come out of prison after a short sentence, there's absolutely no requirement at all to continue that rehab. One of the things we will absolutely clearly do is to have tougher conditionality for release from prison. So if you need to continue in rehab, you can. And then the question is that simply something that's organised locally by the provider in partnership with the local primary care commissioning group? Is it something where we have a separate arrangement with the Department of Health? These are things we're discussing at the moment, but it has to happen.